So I have a little bit of an agenda here. Nicole's already done a fabulous job introducing me. I have nothing to add, so I'm going to skip through a couple of slides. But really, what I wanted to do is just introduce you to our team, let you know a little bit about what health coaching is, what it looks like at the University of Delaware. Talk you through, because we're working with the oncology theme education this week, talk you through what our Wellness Coaching for Cancer Survivors program looks like. The future of health coaching, particularly here in the United States, is very exciting. So I wanted to talk you through some of the sort of recent developments in that area. And I'd really like to spend, the most of our time this evening doing a Q&A. So I'll be a little bit more focused in going through some of this content, and then we'll have lots of time to chat at the end if that works for everyone. So the faces match, so that's good. Before I get started, I would just like to really highlight, we've been absolutely hugely fortunate in terms of the partnerships that we've had and the funding that we've had. So I'd be really remiss if I didn't single out the Longman Foundation, who has funded our program. We're moving into our 5th year, and that's a community pot of money here in Delaware. Some of the original work in coaching with cancer survivors was funded by Laffy McHugh through my colleague, Mary Lou Galantino, who I'll introduce you to in a second. And as Nicole had indicated, we're really lucky that we're very strongly rooted in the community. We work very closely with the Cancer Support Community of Delaware. So Cancer Support Community is a national organization. It comes from Gilda's Club, and we're the satellite for Cancer Support Community here in Delaware. Has been fantastic. So we work across the state with them, and it's been really excellent. So just to, nobody does this alone. So the team that I work with the most is my partner in crime most of the time is Mary Lou Galantino, who's a physical therapist at Stockton University. And she's been really senior and really informative in informing our work. Erica Narducci is our program director with Cancer Support Community of Delaware. So she works really, really closely with us on the community piece, and is, our largest referral source for our health coaching. And Nicole Berzins is my doctoral student at this point, and is certainly well on her way to being a fully formed researcher in terms of all the incredible work that she's doing. And very near and dear to me is Tara Leonard, who's our clinic director for our coaching clinic, and we get to work on all sorts of really exciting programs together. She's really the brains and the engine of a lot of the work that we do. So I just need to put that out front. So where I stumble, it's probably because Tara would have had a better answer. So when she sees this, I hope she knows how much I appreciate her. So let me talk to you a little bit about health coaching. And I'm going to talk about it a couple of different ways, and it can get a little confusing sometimes because there's sort of the health coaching, as in if somebody had like a name tag and it said underneath what they did, it would say health coach. And that's sort of somebody that's working specifically in that professional capacity. And that's great. And we'll talk about that a little bit. But a lot of the training that we do in terms of this health coaching is a skill set. So in those instances, sometimes we are working with exercise professionals. We're working with PTs, OTs, nurses, physicians that just really want this skill set as they're engaging with whatever their client or patient population is. So I tend to lapse into using those terms interchangeably. So I apologize in advance, but just keep in mind that there's the skill set that we're wanting everybody to have. And then there's some people that are calling themselves a health coach and working specifically in that capacity. I think what's really, really important for what we're seeing right now as health coaching is kind of coming into its own, is we're really, really relying on people having some other existing training in the area of health, wellness, and fitness. And then we had on this really important skill set in terms of health coaching and health behavior change. So for example, for our program, for our going into our master's program or our graduate certificate, people have to have an undergraduate degree in a health-related discipline. So we assume that they've got some background knowledge in that area. We teach we do a chronic disease management class as it relates to health coaching, and we do a healthy lifestyles class as it relates to health coaching. But all the other things, we're assuming that they've picked up that skill set somewhere else before they enter our graduate training. So in addition to sort of having this specialization, really what we're working with people is this, and in Nicola's and I's work, we talk about this intention behavior gap. But how do we move people from intention to action, and then from action to sustainable change? So really, how do we make this habitual and lifestyle versus people kind of moving from goal to goal to goal, which sometimes is the default setting, is we can set a lot of goals and get people there, but the kind of the proof is are they still doing it in 6 months or in a year? But we'll talk about all those steps in between. So this is from a 2015 position paper by Meg Jordan and Margaret Warren, and I think that this is sort of the typical language that you'll see right now in terms of how health coaching is defined. So it's really this, it's a very collaborative approach in terms of a partnership with our client, very highly value aligned in terms of where the client's coming from, and we'll talk about that a little bit more in a second. And it's around, it's positive focused around the promotion of health and wellness. Again, who we're wanting to work with are health professionals from a variety of backgrounds, and I feel really lucky tonight that the audience is largely fitness professionals. So whatever that background is that your expertise comes from, and we'll talk about how that works within a health coaching setting in a second, that's really what leads to this sort of client-centered process to develop these sort of goals and action plans around health and wellness, and coping plans, which we'll talk about in a sec. So again, we're looking at somebody that's got a clearly defined skill set and knowledge that we add on this health coaching expertise, and then that person is out there working in the community. So, for example, some of the work at University of Calgary is certainly with people with a kinesiology or an exercise physiology or an exercise psych background. Most of who I train at the graduate level at the University of Delaware are health educators, and we can talk about what a health educator is in a second. But and then there's these sort of more allied health professionals that people are more familiar with in terms of physical therapists, occupational therapists, nurses, and physicians. So a few of the things that I don't want to highlight everything here. Oh, my elbow touched something. I want to just highlight a couple of things, and this is from a review article that got done a few years ago. I want to explain. So a lot of what we're working on with people is from the scope of what's called motivational interviewing. So that's really foundational for some of the work that we're doing. We're really working with people around things like habit formation and bolstering self-efficacy. I had chatted before about that we're really trying to align with what people's values are and what their visions are for what they're wanting to do in terms of their health. And there's a couple of things that I want to highlight a little bit more here that are some acronyms. So OARS, and I just heard this from our previous speaker, is this notion of open-ended questions, affirmations, reflections, and summaries. This whole active listening paradigm that's really foundational to any of the work that we do. The other thing that we do that's foundational that I think really ties into where each provider fits is something what we call elicit, provide, elicit, which is really, we're working very actively with the client to find out what they know about, let's say, exercise, what experience they've had in that area. We provide our expertise in a way that's congruent with their knowledge and the gaps that they have in their knowledge. And then we always go back to elicit, trying to figure out how that fits within their framework. Does that change ideas? Does that change vision? Does that change goals? How is that going to help them direct their behavior? So the other piece that we had talked about is this notion of goal setting and action planning. But the other thing that we spend a lot of time with people on is what we call coping plans. So as we all know from the pandemic, when life hits you, sometimes our best laid plans, don't proceed the way that we would like them to. So we do a lot of sort of if-then planning. So if this thing happens, then I will do this. So we're really constantly working with people around sort of, what's the best solution in any given circumstance. And we're often cultivating work around a range of behaviors versus these sort of finite goals where it's like we kind of do this or we don't. So it's a very nuanced approach. And again, this is largely client directed. So that's just a little bit of an overview in terms of health coaching and some of the work that generally happens. In terms of our program specifics, again, highly tailored to both students and working professionals that are already working in a healthcare setting. And really, sort of guiding people around these areas of sort of self-care and health maintenance. a lot of what we do and how our program came to be called a clinical health coaching program is we already had an existing relationship in the Delaware community working in clinical settings. So working through Christiana Care, which is our large care organization for the part of the state that we're in, and other different community-based partnerships. So whereas a lot of health coaching has tended to be sort of pitched at, let's say, I mean, we could kind of argue about definitions of healthy, but it's been sort of pitched at more sort of healthier populations without necessarily the clinical background. And for us, we've really all the way along have been working with things like cancer and diabetes and cardiovascular disease and things of that nature. So that's where our focus is a little bit different. I want to talk to you a little bit about what our training looks like here for a second. All of our students, regardless of what their healthcare background is, come in and get a course in some foundation in concepts of chronic disease management, and we actually teach that in partnership with our School of Nursing. And then once they get that foundation, they do a fundamental course in behavior change strategies and tactics. So they get a background in motivational interviewing, they get a background in brief action planning, they get a background in something called behavioral activation, and they get a background in something called behavioral health consultation, as well as some of the work that we do in the area of specific to health coaching. So there's a number of different modalities that get covered there that are going to be absolutely foundational to all the other work that they do in the program. Then they take a very specific health coaching class with with Tara Leonard, our clinic director, which is very, 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 oh so very hands-on. It's just practice, 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 practice. And more information that they get both in terms of individual coaching and something I'll talk about at the end around group coaching as well. Then they get a class around healthy lifestyles, mind, body, behavior. So again, regardless of their training background, we give them some sort of foundations from a coaching perspective. Topics that we cover are things like stress management reduction, physical activity, sleep, healthy eating, and then substance use and behavioral addictions, I think, is the 5 topics. And then we have another topic where we're looking at building like healthy social relationships. So that gives them some foundational background. And then we top it off with a 120-hour health coaching practicum where they're really either working directly through our clinic or through the auspices of our clinic out in the community. 80 of those hours are contact hours on top of whatever else that they've done, and that other 40 hours can be is more on the sort of the psychoeducational side. So they're providing more on the education side, but 80 hours is one-to-one contact hours. At the end of all of this, they do a 2-part practical skills exam. So basically, they work with our healthcare theater program, which is absolutely fabulous. So they work with a healthcare theater actor. They go through a standardized scenario where they provide an introductory session. They get a week in between where we watch it, code it, and provide them feedback. And then they do a follow-up session and get further feedback from us. And from that, it's pass-fail with some feedback. And then that completes the training for the program. And then from there, they're eligible to write the national exam, which I'll speak to in a minute. So our program is really rigorous. It's one of the few programs in the country that's highly graduate focused. And in addition to the graduate certificate in health coaching, we actually now have a core within our Masters of Health Promotion. So our students can either take it as a standalone program or as part of a master's program, a Master of Science program with us. So as I just mentioned, one of the nice things so they get a certificate from us, but what it makes them eligible to do is write this National Board of Health and Wellness Coaching Certification exam. I'll give you just a little bit of a background on that. So this is something that's just hugely, hugely exciting, and we've been absolutely privileged to be able to work alongside the National Board and the National Board of Medical Examiners for the last few years in terms of the development of this exam. So I was really fortunate to be an exam writer for the first couple of years, and then Tara Leonard has very capably continued to be an incredible writer for this exam. And this is what leads to our national approval and accreditation. it's been really exceptionally interesting to work with the National Board of Medical Examiners. If you're not familiar with the NBME, they're part of a lot of the physician certifications down here. So it's a very well-established and well-regarded institution that has taken on health coaching as part of their mandate and work through us to sort of proctor their exams. So that's been really, really helpful. So the skills that we test around at a national level are these things that happen, initially in the coaching process, this maintenance piece, this sort of further integration, and then this professional behavior of coaches, as well as some of these lifestyle pieces that I'd spoke to earlier. So that's kind of what our training looks like. I just want to take a second to talk to you about what our clinic looks like for a moment. So we're really, really so lucky that several years ago we had a large tower, 10-story tower, purpose-built for our College of Health Sciences, called the Star Tower. And it's really interesting. It's actually built on an old Chrysler automotive plant. So the Newark, Delaware was definitely a Chrysler town for many years. I live on Chrysler Avenue. And so when the university bought that from Chrysler, one of the things that they first built was this large 10-story tower, and that holds our whole College of Health Sciences. But we're really lucky on that second floor of that tower, we have significant dedicated office space, both for our students, our faculty and staff, and then training areas where students can record themselves and can see clients, and we do bioassessments, all sorts of different things. The other thing that's nice about that space is we get to work really, really closely with our nutrition clinic and with our exercise physiology program. So I'll talk to you about this in a minute, but we're referring out and back and forth all the time, and not in the tower, but in another part of that building, we have a nurse managed primary care center, and we're able to work with them as well. So it's kind of everything that you would want under one roof. And then we've got physical therapy and speech language as well. So we're really lucky that that's all there as part of this tower, and we've got multiple clinics that we can work through. So again, our mandate through the Research and Training Center is really, first and foremost, as a training center for us to train these coaches at a national level. We're really excited about some of the research that we get to do. Rather than go through all of it, I'm just going to go through some of the cancer stuff. And then the other piece that we're getting asked to do more and more is to work as a community consultant and liaison. So we're out there in the community, either working with practicum sites, helping people develop their own training, or help people develop new programs. We've got a really exciting one that we're just about to start to do with the state of Delaware around working with peer support workers that we're really excited about. So yeah, we're just working across multiple levels right now in the community. So that's been excited. We have there it is. We have a little bit of, we found out kind of what works for us. Most of what we sort of see working and sort of the paradigm that we've kind of seen in most of our programs that we're putting out there right now is we tend to see a 90-minute initial session that we do with people that's really assessment focused. And then we tend to see people bi-weekly, and we see them for about 30 minutes. And that's worked really, really well for us. Now, we have some people that are coming in on an individual level where that might be a little bit more nuanced, but in terms of programmatically what we're putting out there, this is pretty typical and would be typical of our wellness coaching for cancer survivors program, which I'll give you a little bit of information on here in a second. There it is. So again, we know with cancer survivorship in the States, it's a huge issue. And I'm sure you've heard a lot about this week, so I'll try and be brief. It's so much about the primary diagnosis, but we know that people are more likely to have a recurrence or a second cancer, and then this notion of increased morbidity, mortality around other illnesses. We hear this a lot, and I just caught this out of the tail end of my ears just as I was hopping on from the previous speaker, that people kind of know what to do, but they don't know how to do it. So we see so many times where particularly our cancer survivors are incredible repositories of knowledge. They have multiple PhDs from Google University. But their ability to sort of implement and sustain a plan is the thing that's really, really hard. And it's really, really hard because it's really, really hard for all of us. It's not a cancer thing, it's a human thing. So, you know, the concerning stats that we hear that unfortunately aren't that different than stats for people that haven't had a cancer experience is, you know, less than 25% of cancer survivors are physically active on a regular basis, you know, and huge areas around sort of metabolic health. So as I'd mentioned before, people know what they need to do. They're just having trouble doing it. So this is sort of a quote around physical activity, but I want to get into some specifics around health coaching. So this is what we're seeing in our program, and this is what our colleague Mary Lou Galantino has seen in some of her earlier work. We really see that there's this opportunity to make this bridge between clinical medicine and whatever's been happening within a treatment setting, be that them being on active treatment or back out in a sort of a larger post-acute treatment survivorship role. There's this ability to sort of bridge the clinical medicine piece in these health disciplines to improve overall care. And we'll talk about this sort of de facto care coordination that sometimes our health coaches are doing. It often provides an important avenue for our cancer survivors to discuss the impact of their health and well-being globally that they might not be able to do with any other one professional. So for those of you that have had a cancer experience, I'm sure that this resonates with you, that you see this doctor for this thing and this doctor for another thing. And sometimes those appointments never really seem to come together. And what we find more and more with our health coaching is it's a place where people kind of put it all out there, and I'll show you how that gets put out in a second. The other thing that we're seeing more and more now is that our coaches can be really supportive of recommendations given by an oncologist or in primary care or other professionals. So the stat that goes around here in the States is that 50% of medical visits are wasted medical visits. So within a period of a few days, most people can't retain enough to act on what they got from a medical appointment. It's just they're just not retaining it in a way that's actionable. So what we find with the health coaching is that it creates this opportunity for people to have a touch point and a plan so that the things that their oncologist or another health professional is telling them to do, there's probably increased the likelihood that they'll be able to set a goal around it, develop an action plan around it, and maintain it over an extended period of time. And that can be things like physical activity, but you'll see some other areas that we're working in as well. We've got colleagues at the University of California, San Francisco, and most of what they do is medication reconciliation and getting people to stay consistent on the medications that they're on. So the other thing that we do in terms of this care coordination is we're oftentimes quarterbacking as part of somebody's journey towards wellness, making sure people are getting connected back with other resources. So back to their primary care provider, back to our we've got an incredible social work team through Cancer Support Community of Delaware. So really making sure that all those bases are covered and that can all be part of the work that they're doing with us in an integrative way. So here's a little bit about kind of our current wellness coaching for cancer survivors program. We really work with anyone at any stage of diagnosis and anywhere across the cancer continuum. So this is going to sound researchy, but please know that the Longwood funding that we have was programmatic funding. They wanted things evaluated, but they're not as interested in research per se. They just want to see good services provided to Delawareans, and that's always been our mandate. So as part of that, we've had this really expansive mandate when we're working out in the community. So again, you'll see we have our 6-session format, about 90 minutes in the first session, 30-minute follow-ups as well. We had done, we were working across the state pre-COVID. So Cancer Support Community of Delaware has 4 offices across the state. So our coaches were putting miles on their cars, driving around, seeing people, in their neighborhoods, in the places that they lived, through the Cancer Support Community of Delaware. Of course, with COVID, we've gone fully online and have been that way. It'll be 2 years this coming spring, and then it's worked really well. And again, it's a rolling admission because we're working with people individually. So here's some of the things that we talk to people about in no particular order. We talk to people a lot about sleep. That's a main concern. And I'll show you how those sleep numbers in a second here. We hear a lot from people about treatment side effects, and that's where our work with Dr. Galantino has been really helpful. That's absolutely her area. She works in this area as a physical therapist with these treatment side effects related to oncology. We talk to people a lot about physical activity, nutrition, and then things like time management and care coordination. The things that we weren't expecting to talk about are these financial implications of survivorship. As many of you can imagine, the care model here in the United States is vastly different than what it is in Canada. In Canada, we know that it can also be a huge financial hardship going through treatment. I would say probably even more so here, depending on kind of what insurance you have. So we hear a lot about that. We're really lucky through our partnership with Cancer Support Community of Delaware. We actually have access to a pot of money to sort of help people negotiate some of these barriers as they come up. Again, we have these sort of unique referrals and resources that we've learned a lot about. We're learning more and more about the timing of the relationship. It would be an interesting conversation for us to have. Again, we find that people want to do it when they're on active treatment, but oftentimes they're waiting until they get through their chemo or rads. So people are kind of wanting to do it post-acute treatment. And then, of course, we hear a lot about complementary therapies from people, and we try and be supportive from an evidence-based perspective. And where we don't know, we tend to want to refer them back to whoever their sort of specialist is in that area. And then here's some additional resources that we provide to individuals. I had mentioned kind of in terms of promotion, Cancer Support Community of Delaware initially and continues to do the majority of our promotion via social media, via fundraiser events, via word of mouth at their 4 offices in Delaware. Mary Lou Galantino has been absolutely incredible as a referral source in getting our word out to their health providers that are now have had some success in our program and are wanting to see their patients go through something like this. And then we're allowed to do some formal work with Christiana Care through our local Helen F. Graham Cancer Center, where we, again, through Cancer Support Community of Delaware, we're allowed to do a little bit of promotion that way as part of some other work that they do. Excuse me. Most of our funding right now is through the Longwood Foundation. Again, we've gone through 2 phases of the grant. We did a development grant, and then we went through an implementation phase. So we're looking at a 3rd phase right now that I'll talk about towards the end. And then we have some other funding through American Lung Association, Highmark Blue Cross Blue Shield, which is an insurance company, and then some other foundational awards. So I just want to take you through kind of this is a few years ago now. We're in active recruitment for sort of phase 2. So this is some of our phase 1 development data that I wanted to share with you. So this was 2018 to 2019. We've incentivized this now, so our completion rate in terms of follow-up measures is a little bit better now, but we screened 75. We had 51 complete baseline, 48 started coaching, and had about 33 complete baseline measures. I won't go through these here. I'll show you kind of the data, but these are some of the things that we looked at. You can see, largely in terms of gender, it was female. You can see really that's for that 45 to 65, and then the sort of breakdown in terms of county and overwhelmingly breast cancer. So here's the interesting stuff. So you'll see that our attendance rate for those 6 sessions is about 85%. And then I want to just show you kind of where we're seeing some changes. So one of the things that we had asked about and we talked to people about is this area of stress, and we certainly see reductions in stress over that 12-week 6 session period. Anxiety and depression was an interesting one for us. So originally we had just used this as a screening tool, because we wanted to make sure that if anybody was, meeting some of the clinical cutoffs, that we were getting them to a mental health resource sooner versus later. Then we had a lot of discussion around and said, we should really probably be doing this pre and post just to see if there's any change. And again, keep in mind that this is a single group design, that for health coaching, they could come in with any presenting issue, and we just happened to measure these ones. But what we did see is we saw some fairly significant decreases in anxiety and significant, but to a lesser degree, to depression. So that was really interesting for us. The other piece that you can see here is we certainly see these increases in physical activity. So we see increases in weekly MVPA, both in terms of overall, and then in terms of number of bouts. So that again was really interesting to us. One of the things that we had asked about was healthy eating, and again, our clients were noticing a difference in terms of their eating behaviors, and we used something called the rapid eating assessment protocol for this. Sleep was very interesting to us. So we saw a significant change in sleep quality, increases in sleep duration, and then sleep efficiency. So that's really from when you go to bed to when you go to sleep. So overall, we were hearing from people that their sleep was better, that they were sleeping longer, and that they were falling asleep faster. Which is, if you've worked in this area of sleep and fatigue and in oncology, these are really notable things to be hearing from clients. We also saw significant improvements in quality of life, so physical, emotional well-being notably, but we also saw these improvements in functional and total well-being. So one of the things that we like to highlight for our funders and for our community is that really we're able to be in the community, offering this program, doing some evaluation with professionally trained coaches that is at no cost to participants. So we're really fortunate in partnering with Cancer Support Community of Delaware. Nationally, they have a no cost mandate. It really is funded by foundations and donations. So we're not charging a fee for this. The win for us with this partnership is that we're really able to provide our expertise as researchers with expertise in health coaching, and working with a community-based partner that's got decades of experience in cancer survivorship and working in this area of program implementation. The other thing that we're working on more now with our second phase is really this notion of how do we do this work in a more nuanced approach based on the various demographics and changes throughout our state. So Delaware is a very, very small state. We're just about 1 million people. We're not that spread out. You can kind of drive up and down the state in a couple of hours, but it's very, 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 very diverse. So some people say that Delaware is really a microcosm of the United States as a whole. So Northern Delaware versus Southern Delaware is very, very different. So we're trying to sort of meet those needs wherever we're at, and it's been very, very helpful. So the last thing I wanted to spend a little bit of time on was just to sort of talk about sort of future directions and where we're aiming next. So again, we're now that we're sort of, not that we're ever out of the pandemic, but the genie is out of the bottle, is what we keep saying. So as much as people like the in-person, people really like the convenience of telemedicine or Zoom. So we're trying to figure out what that sweet spot is for this population base. The other thing for us is we're literally able to meet people where they are now in a way that we couldn't before, in terms of providing adequate access. The other piece that's really interesting is we're getting on a national level, independent of this wellness coaching for cancer survivors, on a national level, we're getting asked to do more and more group coaching. So group coaching can come in a couple of different modalities. It might be that you're working with a group around some sort of psychoeducational component, and then you're doing some group coaching at the end where you're doing some goal setting, action planning, coping planning as a collective, or sometimes it's more of a hybrid where they're getting some some work together as a group in terms of the educational component, but then they're still getting the individual coaching afterwards to further tailor it. So it's really a model in the making, and some of the work that we're doing right now, very thankfully with the expertise and help and goodwill of Nicole, who's hosting us tonight, is really trying to figure out what that model might look like as we move forward. And again, we're looking at this intersection between remote and in person. The one that a lot of people are really excited about now, though, is will health coaching be reimbursable in the United States? And there's some very preliminary evidence that it might be. So we're really lucky that we've got Category 3 CPT code. So this is current procedural terminology, it comes from the American Medical Association. Category 3 codes are really experimental codes where they gather data on health coaching and outcomes for a period of 3 years nationally. So this was a beautiful project that got put together by for health educators, health coaches, in partnership with Veterans Affairs. So this all rolled out January 1st, 2020, and they're going to look at it again January of 2023. And from there might be a possibility that these level 3 codes make this transition to level 1 codes, where this actually becomes a billable service. Right now, we've got 3 experimental codes. We've got an initial intake code, we've got a follow-up code, and then we've got a group coaching code that we're starting to track now. The other work that we're doing in terms of these NPI codes is really that people wanting to use their health savings accounts to fund this work. So one is willing to insure, one is somebody using their health savings account towards this work, and it's looking like there's some potential for this to be a billable service. Right now, the people that are using those experimental codes are health educators and then health and wellness coaches. We're really lucky at our program in University of Delaware is that people can come out and be dually credentialed, so they can write both certificates at the end. So I've had a number of students over the year that are certified both as a health coach and as a health educator, and it opens up a lot of opportunities. So that's me going a million miles an hour to try and cover all the stuff that we're doing.